New numbers are giving us insight into how COVID-19 is affecting our region's hospitals right now. I'm Laura Moritz. KMBC 9's investigative reporter Matt Fleener is live at Truman Medical Center to explain.
Well, Laura, for the first time in this pandemic, you and I can see how COVID-19 is impacting specific facilities. So we can look up Truman, we can look up any other hospital here in the Kansas City area and see how the virus is impacting staff and patients. Tonight, KMBC9 Investigates is taking a look at brand new COVID-19 numbers broken down by individual hospitals across the country. A first of its kind release from the U.S. Department of Health and Human Services.
So it's historical data. It shows trending so we can see where hospitals have been.
Steve Hager has tracked hospital capacity around Kansas City with the Mid-America Regional Council. He says the new data allows us to see how COVID is stretching capacity, but does not quite account for where we stand today.
So there's value in the trending perspective, but not a lot of real-time value in what we're seeing immediately.
If you want to see daily numbers, the Mid-America Regional Council is publishing daily snapshots by county. We checked. That dashboard shows Clay County only has 4 ICU beds available. The entire region, just 94.
It's in a more usable format that people could more easily digest.
Hager says hospital capacity is somewhat better than the first of last week, but it's not time to let our guard down.
We're really hoping that we are seeing our numbers down because people did adhere to those recommendations.
And bottom line, it is specific to facilities, just how hard those facilities are hit. Some are seeing record numbers right now, others are lower than last week. But this data should really help us into the future make decisions on how hospitals are being impacted. Matt Fleener, KMBC 9 News.
That data set shows hospitals in rural counties are getting hit very hard by COVID-19. On Thursday, 92% of ICU beds in Johnson County, Missouri were occupied by COVID-19 patients. KMBC 9's Matt Evans went to a hospital in Warrensburg that's at capacity.
Here at Western Missouri Medical Center, the only hospital in Johnson County, Missouri, about an hour east of Kansas City, they're seeing about half of their total bed space being taken up by COVID-19 patients. The majority of their ICU beds taken by COVID-19 patients. But those are far from the only problems that rural healthcare providers are facing across the state of Missouri.
So these are our gowns.
Nurses at Western Missouri Medical Center.
It's been very challenging. It's definitely a new world for all of us.
Taking us inside their ICU.
We've had an increase on patients, especially COVID patients that have been coming in.
This room, just one of 2 ICU beds that aren't taken.
Yeah, it's definitely been a little more stressful, especially when it fills up your entire hospital.
But they won't be taken anytime soon because there's not enough staff right now to run them.
Now we are hitting, staff being out for COVID related. Either their kids have it, their spouse has it, they're quarantined, they have it. And so 10 employees out for us is a large percentage of people that care for our patients. And so honestly, staffing has been an issue.
In Johnson County, more than a third of the nearly 3,000 total cases were added last month, leaving medical professionals here pleading with the public.
Wearing your mask and making sure you're at least washing your hands and being precautious about those people that you interact with.
In Warrensburg, Matt Evans, KMBC 9 News.
Hospital leaders there say they have started to see numbers plateau and are hopeful to add more staff soon. Before COVID, it happened once a day in America, doctors taking their own lives. But one doctor told KMBC 9's Chris Ketz it's gotten worse because of the pandemic.
They work in a job where they see tragedy and death every single day, and it can lead to things like depression, anxiety, PTSD, and yes, even suicide. In fact, a couple of years ago, the American Psychiatric Association listed doctors as having the highest form of suicide of any profession. And now they're in the middle of a pandemic. And that's made an old problem worse.
We're supposed to give help, not ask for help.
Dr. Pamela Weibel faced suicide herself 8 years ago. She's still practicing medicine in Eugene, Oregon, while also running a suicide helpline for doctors and others working in medicine.
The generic 1-800 suicide helpline might work for some people, but for physicians, they're going to have a fear of losing their license, talking to someone who's an unknown entity.
Dr. Weibel says too many doctors feel like they put their careers at risk even reaching out for help.
I mean, there are some medical boards that have 25 yes or no, have you ever had mental health related questions on their medical licensing application. And so because physicians are so honest by and large, we would rather not get the help so that we don't have to check the yes box that we've received help.
Before the pandemic, she might have heard from 5 to 10 doctors a day. Today, it's twice that many, which is an even scarier thought, given the pandemic isn't over yet. Dr. Weibel says Missouri is ahead of the curve on this, having passed legislation 4 years ago screening medical students for anxiety and depression, offering help to them. She says Missouri is one of the few states offering this kind of help. Back to you.
Chris has a link to Dr. Weibel's site on his KMBC Facebook page right now. Here's a look at the positivity rate in our area. Right now, 17% of tests in Kansas are coming back positive for COVID-19. That is down from last week. In Missouri, 19% of tests are coming back positive. That's also down compared to last week. Platte County, Missouri has new quarantine guidelines. Health officials say people who have been exposed can end their quarantine after 10 days if they've had no symptoms. They still need to wear a mask and monitor symptoms for 14 full days. Platte County is not adopting the CDC's new guidelines about ending quarantine after 7 days with a negative test. Health officials say there are too many cases out there and the testing system is strained. For the latest developments on the pandemic, click on the coronavirus tab at KMBC.com or download our KMBC 9 News mobile app.